This is a continuation of the respiratory narrated PowerPoint. I realized we were cut off. I just have 15 minutes of recording time, which is pretty good because that's a long time to listen. But I want to talk a little bit more about gas exchange. I think we left off close to this slide. Gas exchange involves, very importantly, the respiratory membrane. This is the actual, let's say, interface where gas exchange between blood and air occurs. This occurs primarily in the alveoli, surrounded by its capillary network. Some of this occurs in respiratory and bronchioles and alveolar ducts. It does not occur in other bronchioles, the bronchi, or the trachea, and it is influenced by the thickness of the membrane and the total surface area, which is really important, of the membrane, and the partial pressure of the gases. So the respiratory membrane can increase, an increase in thickness would decrease the rate of diffusion. So for example, any kind of swelling or pulmonary edema would cause a decrease in respiratory exchange. Oxygen then is affected before carbon dioxide, so carbon dioxide could accumulate, but not as poorly as oxygen would be deprived of diffusion, because carbon dioxide diffuses more easily than oxygen. Surface area, you noted the alveoli and their surface area, their grape-like structure. The total surface area is like a basketball court, and it can be decreased due to removal of lung tissue because of surgery, for example, destruction of lung tissue by cancer, or reduction in surface area of the alveoli by emphysema. Cells use oxygen and produce carbon dioxide, so the blood returning from the tissues and entering the lungs has less oxygen, less pressure from oxygen, and increased carbon dioxide or pressure from carbon dioxide. Oxygen will diffuse from the alveoli into the pulmonary capillaries or the blood system. Carbon dioxide will diffuse from the capillaries into the alveoli and then finally out through the process of exhalation or expiration. Here it is diagrammatically that shows you the oxygen exchange, the redder color representing blood high in oxygen. So oxygen diffuses from the alveoli, which have a higher pressure of oxygen than the blood returning. Carbon dioxide, which has a higher pressure than the carbon dioxide, or there's more in the blood than in the alveoli, and therefore the carbon dioxide will diffuse out into the alveoli and will be expired. Inspired air is higher in oxygen, and the oxygen will diffuse into the blood that is low in oxygen. So spend some time with this diagram. If you have questions, make sure to message to me. Blood will flow from the lungs through the left side of the heart to the tissue capillaries. Oxygen diffuses from the capillaries into the interstitial fluid because there is less less oxygen in the interstitial fluid than there is in the capillaries. And then from the interstitial fluid, it diffuses into the cells. And this shows this to you diagrammatically. I'm not going to belabor this with the carbonic acid production, but the take-home message is the oxygen will diffuse out of the red blood cell into the tissues. This is a red blood cell returning from the alveoli. And carbon dioxide will then, in the alveoli, carbon dioxide will diffuse out of this red blood cell that is now low in oxygen and high in carbon dioxide, and oxygen will then diffuse in from the alveoli to this red blood cell. All right, I'm not going to belabor this. We talked, I think, enough about this. So I'm going to move on to the next slide. There is a chemical control of breathing brought about by both changes in acidity of the blood, or pH, which is affected by carbon dioxide levels. An increase in carbon dioxide causes a decreased pH, and that results in increased breathing. Low levels of oxygen in the blood stimulate these chemoreceptors. They are located in the carotid artery and aortic bodies, and this increases the rate of breathing. So in the carotid and aortic bodies, which are located in the arteries of the same name, in the carotid arteries and in the aorta, this will cause increased breathing. That makes sense. Low oxygen, increased breathing. And this shows this to you diagrammatically. And this is the end of this second part of the respiratory system PowerPoint. I hope to hear from you soon. Enjoy learning more about the respiratory system. And goodbye for now.